for being here. We really haven't, having held dozens and dozens of press conferences here at Queen's Park, we've never actually done this, and it's, which is a press conference really to say that the government, the Ford government, has lied outright about its intentions to privatize our local public hospitals, and that this is serious enough that we feel that, it cannot go without challenge, that a government would lie leading into an election about what it's doing at that time, and then do the opposite of what it said it was going to do, literally the opposite, after they got elected. But that is what's happened. And I have to say, we've been watching this for some time with really serious concern. There's a level of dishonesty that this government practices that, is unusual, that we really haven't seen in the past. And it's not acceptable. It's profoundly undemocratic. It's unacceptable. And it has to change. I'll just run through the facts. Last February, then Health Minister Christine Elliott, so we released a briefing note today with the facts and the evidence to really charge the Ford government with lying leading into the provincial election about the fact that it was actually expanding the privatization of hospital services by expanding the private for-profit clinics at the time, even while it sent spokespeople out to local media across the province categorically denying that they were doing just that. And then post-election, immediately announced their plans to privatize public hospital services through private clinics and hospitals, even after having denied it for months leading into the election. So this is what happened. In February, then Health Minister Christine Elliott said in a press conference, in a Doug Ford press conference, that they were going to open up, pediatric surgeries, cancer screenings, and make sure that they could allow independent health facilities to operate private hospitals. It was a bombshell. I was walking through the living room and saw it and thought, what? And, went back and watched the recording multiple times, because independent health facilities is a euphemism in Ontario for the private for-profit clinics. 98% of them are for-profit, according to the Auditor General. Ontario has banned private hospitals for 50 years, literally 50 years. From 1973, no new private hospitals could be built. The Private Hospitals Act bans all future private hospitals, passed and came into effect in 1973, and it bans them from expanding the private hospitals. The point was that for almost well over 100 years now, in many communities across Ontario have labored to build their local public hospitals and to build a public hospital system. And so, for good reason, private hospitals are banned. So we immediately held 20 press conferences and 20 emergency summits across the province. This was in the context also of the Ford government moving forward with privatizing long-term care, privatizing home care, privatizing vaccinations, privatizing COVID testing, allowing the private COVID testing sites to charge patients $200 or more for medically necessary COVID tests, allowing Maple and others to charge patients outright for access to doctors in violation of the Canada Health Act. So unprecedented healthcare privatization happening across the board. So we held 20 press conferences and 20 summits across Ontario warning that the government was engaging in unprecedented privatization, and that it looked like they were going to privatize the hospitals and expand the private for-profit clinics. The government denied it categorically. In town after town, they sent a spokesperson who said that what we were saying was, quote unquote, categorically false. And we've provided the links for 4 examples of that, but there are examples all across Ontario. And yet at the same time, this is February, March, April, leading into the provincial election. At the same time, According to the Financial Accountability Office of Ontario, the government had increased the funding in the fourth quarter of the year. In those months exactly, had doubled the funding for the private clinics, doubled the funding for the independent health facilities in Ontario. So as the Ford government sent out a spokesperson to tell the local media that they were not in any way expanding the private clinics or intending to privatize hospital services, they actually doubled the funding. It's not insignificant. It was $13 million increase to funding for the private clinics in Ontario. Unless you think that was because, they underfunded them for the early part of the year, and so they just bumped it up in the fourth quarter. In fact, they increased the funding for independent health facilities last year over projections by just over $12 million. So very significant increase to the funding for the for-profit clinics, even as the government was denying leading into the election that they were expanding the for-profit clinics and privatizing hospital services. And then within, by the beginning of August, after the election, the Ford government then, no holds barred, made a sea change from what it had told the public before the election and announced that they were going to privatize our hospital services. So, just to sum up, the Ford government lied to the people of Ontario leading into the election. You can't just outright deny that you're expanding private for-profit clinics when you are in fact shunting millions of dollars over to expand the private clinics. You can't pretend that you're not going to privatize before an election and then immediately after the election announce that you're going to privatize. This is not minor policy. This is our public hospitals. Virtually every community in Ontario has spent the last 100 years building our local public hospitals, donating through payroll deductions, donating and volunteering and literally building the local public hospitals. This is the dismantling of our local public hospital services. It is serious. It is something that all Ontarians care deeply, deeply about. It is unacceptable for the Ford government to lie to the people. They have no mandate. They must stop their privatization plans for our hospitals. And with this press conference today, we're announcing that we will begin a massive campaign across Ontario to fight back. We'll be holding town hall meetings across the province. We'll be doing mass outreach, mass community organizing. We'll be holding rallies and protests and events across Ontario. We will escalate them, and we will not stop until the Ford government stops. What they're doing is profoundly undemocratic. It is wrong by any measure, and we are going to stop it in any way that we can. And I'm pleased to introduce Duff Conacher. He's the co-founder of Democracy Watch, an organization which you all know in the media, is a protector and safeguard for our democracy. Please go ahead, Duff.
Thank you very much, Natalie. Well, I would say that I'm happy to be here today to support this calling out of misleading by the Ford government, but I'm actually very unhappy to be here today because the public has a right to politicians who tell the truth and to not be misled. When a politician makes a false statement, especially a false statement leading up to an election or a false promise in an election platform, it's a fundamental violation of voters' rights. And it means that the government that is elected that breaks that promise is doing something illegitimate. And especially when you have a government that's elected by actually the ballots cast by only about 20% of eligible voters, to be switching direction and after misleading voters and baiting them with false statements before the election, it's just fundamentally undemocratic, unethical, and a violation of voters' rights. Unfortunately, it's becoming routine in Canadian politics. We have a pandemic of misleading by politicians, misinformation, and disinformation. And we need an honesty in politics law to stop it, with very high fines for any false statements by anyone in politics, but especially by politicians and party leaders. We need leaders, not misleaders. And we need to stop this pandemic of misleading with an honesty in politics law with severe penalties. Democracy Watch's proposal is that the party leader who makes the statement would be fined a minimum of 1 year's salary, and the party would have to pay the same fine for choosing a misleader instead of a leader. This is what's needed to stop this pandemic of misleading by politicians that are violating voters' fundamental rights to honesty in politics. And this is not the first time the Ford government has lied. And there are lies by other parties that we're seeing at other levels of government and politicians at municipal level as well. It truly is a pandemic of misleading, misinformation, and disinformation. And it has to be called out every time, not just by the media, but we need an enforcement system that is stronger than just reality checks in the media and checks of promises during elections. We need actual penalties for misleading to encourage parties to elect leaders, not misleaders. So again, I'm happy to be here today to support this calling out, but also unhappy that we are seeing this pandemic of misleading. I welcome any questions you have.
Thanks, Duff. So, and we're supporting, the Ontario Health Coalition is supporting this call for an honesty in politics law with stiff fines and penalties for leaders and provincial parties who lie to the public or mislead the public deliberately about what they are doing in government or what they're intending to do. So we'll open it up for questions. I believe are there people on the phone line?
No, there's no one on the line.
Okay. So I'm sad that there's only one media person here. I hope that media, it matters, right? That this should matter. This is our public hospitals, 140 of them across Ontario. Major public assets, public services for communities. They belong to the people of Ontario. And I hope that the media sees this as worth reporting. Thank you for being here.
What do you hope to achieve with your campaign? Do you really think the government could backtrack and decide not to turn towards privatization?
Oh, yeah. There's no question. One, the Ford government is dropping in the polls. It's dropping in the polls largely because of their terrible performance on healthcare and because of their plans to violate the rights of seniors who are in hospitals waiting for long-term care homes, to assess them without their consent, to share their personal health information with an array of providers without their consent, to fill in their application paperwork and then send them, admit them into long-term care homes without their consent that could be 150 or more kilometers away in the north, 70 in the south, and then also other types of health providers. So that obviously is very serious on people. That cuts across all party lines. People in Ontario did not like that, and that dropped them. But also just the fact that we have almost 100 emergency department closures now across Ontario since the beginning of the summer. It's unprecedented. They lied about that in the summer, refused to call it a crisis, downplayed it, dissembled, everything except for, admit what was actually going on in the hospitals. And they've done substantively nothing to deal with it. They're intransigent on Bill 124. Wage restraints in the middle of a pandemic, it's ludicrous. For the people that are risking their lives, they won't even pull those. And they're just, more of a symbol than anything else, but also just won't deal with the absolute crisis, like unparalleled crisis that we're seeing in our public hospitals, and instead have opted to shunt millions to the for-profits and privatize them. People in Ontario already don't like that. Yeah. Totally, yeah.
Maybe if you tell Ontarians that we will use private clinics for some types of services, but it's going to be faster and it's not going to pay anything. Do you think some
that doesn't exist.
Would be into it?
Yeah. That's sort of the mythical land, right, that people talk about. But the fact is that the private clinics that exist in Ontario do charge patients literally hundreds or thousands of dollars for services that we already paid for in our taxes that should be covered. Like last night, I just got a note from one of our members who was charged $700 for extra eye measurement tests in their private cataract surgery clinic. $700, it used to be $200. $700, those are medically unnecessary. The physician has an obligation to tell the patient that they're medically unneeded. The OHIP covered eye measurement is perfectly good. There's no added efficacy of doing that. Of course, they didn't tell the patient that. Then they charged them $2,000 for the cataract surgery, a violation of the Canada Health Act, outright violation of the Act. That's what private clinics do. They do it everywhere. So there is no, oh, there's a free, you're going to use your OHIP card, etc. That's utter nonsense. We phoned every private clinic in Ontario 4 times in the last 12 years. We phoned every private clinic across Canada twice. We asked all of them, and we recorded the transcripts. They were published on the front page of the Globe and Mail. Like, this is irrefutable. The vast majority of them extra bill patients in violation of the Canada Health Act. Hundreds or thousands of dollars. The prices are exorbitant. For shoulder surgery, it's 10 times the public cost. You know, for an MRI, it's 4 or 5 times. For cataract surgery, it's 4 times. I mean, ludicrous prices, and they undermine public Medicare. There are 2 private hospitals left in Ontario, Don Mills and Shouldice. I just heard yesterday also from a member of ours who had went to Shouldice to be assessed. They only take healthy patients. They don't take the overweight people with diabetes who might code on the operating room table. They take the profitable, easy patients. They don't run ICUs and have all of the complex setup of a normal hospital. So, you know, the person had COPD and they wouldn't take him for his hernia surgery. He has to go to a public hospital. You know, there is no mythical land where you have a private for-profit clinic that provides the same service for the same types of patients for, you know, the same money without extra billing them. That does not exist. And you know, trying to claim that is just utterly false.
And I believe you speak French. Do you speak French?
Oui,
Yeah,
oui, je peux le
okay.
faire.
Juste peut-être vous entendre un petit peu sur le fait que bon, vous trouvez que le gouvernement a fait campagne sans parler de cet aspect ou cette volonté de se tourner vers le privé. Et là maintenant, 4 mois, 5 mois, je pense, depuis l'élection, on semble prendre un virage vers les cliniques privées. Qu'est-ce que ça dit exactement pour l'état de la démocratie?
Alors, c'est difficile pour un juge de changer les résultats d'une élection après l'élection, seulement parce que le politicien dit quelque chose qui n'était pas vrai. Mais on peut avoir un système avec le commissaire de l'intégrité, faire une investigation et après une pénalité comme une année du salaire pour le porte-parole d'une partie. Et on pense que ça va changer les actions des politiciens si la pénalité est comme une année du salaire pour les politiciens.
Mais c'est pas que les progressistes et conservateurs. Là, on a vu d'autres gouvernements faire la même chose. C'est quand même une pratique courante où c'est quand même répandu qu'un gouvernement fait campagne sans mentionner certains éléments d'une plateforme secrète. Puis après ça, une fois élu, va mettre en place des mesures pour lesquelles les électeurs n'étaient pas au courant ou n'ont pas voté.
Oui, alors, si le gouvernement, une partie n'est pas une plateforme et changer la direction aussi, ça c'est aussi quelque chose qui est pas honnête complètement. Et je pense que le loi pour avoir un honnête en politique peut couvrir cette situation aussi. Merci.
Merci. Okay, thank you very much.